Go ahead. Action.
Hi, I'm Andy. I work with the mobile unit as a critical care nurse and a vascular access nurse, and today we are going to be going over how to access an implanted port with our all-points port access system. Now, to do this, you're going to need your port access kit, you're going to need a needleless connector, and you're going to need a bio patch. Now, the kit does come with 2 sets of sterile gloves. I prefer to have my own pair of sterile gloves because these sterile gloves sometimes tend to rip and are a little too small for my hands. So before we start, obviously you want to tell your patient what you're going to be doing. You want to educate your patient and their family what you're going to be doing. Prior to insertion, you want to make sure you really know where that port is. Most ports nowadays are the barred ports, and they have 3 little knobs that you can easily palpate to find out where the port is. And obviously before you go to access them, you want to use some sort of local anesthetic. You can refer to policy 77 about that, whether it's going to be subcutaneous lidocaine injection or if it's going to be the lidocaine cream. If it's the lidocaine cream, you're going to want to let that sit for at least 30 minutes under a tegaderm, and then come back and clean it up really good before you go ahead and do it. Alright, so let's get started. So for me to do this kit, here's the kit. Again, it also comes with its own sterile saline. Do not use the sterile saline that we use regularly. That is, the outside of that is not technically sterile. The fluid is, just the outside of it. So, I'm going to tear that off. And before I start, I'm going to hand sanitize. And I'm going to set my kit up, my sterile field up right next to the patient. Now, the all-points port access system actually has instructions, which we will be following. And the instructions are right here as follows. I'm just going to lay that right here for my reference. All the unnecessary paper stuff we're just going to move out of the way. There are 2 masks in this kit. There's one for the patient and one for me. So we're going to mask our patient and mask me. And there are also 2 sets of sterile gloves. If the patient already has a port, you can use that pair of sterile gloves to remove that access, which we will be demonstrating after we insert this. So while I set this up, I'm just going to use this sterile glove and the hand sanitizer. Even though I just hand sanitized, we're going to go ahead and hand sanitize again with the little Purell pack here. And all you do is bend in half, squirts in your hand, hand sanitize. And we're going to don our sterile gloves. Even though we're not going to be doing anything sterile, we're just going to use these gloves in the kit while I get the kit, the sterile field ready. And here's our sterile field, and how it works is you open it up and it unfolds like so. Here's your second pair of sterile gloves, which I'm going to put over here, but I'm going to use my surgical gloves instead when I get to that point. I'm going to open this up, folds down. Now remember, since it's sterile, don't touch anything on the inside. And I'm going to go ahead and open up and drop in my needleless connector, my sterile saline flush, my bio patch. Alright, now I'm going to move aside all this unneeded stuff. I'm going to take off these gloves. Again, I'm going to hand sanitize before I put on the sterile gloves. And like I said earlier, I'm going to use the white surgical gloves that are sized fit to my hands. I feel like it's really important to use gloves that really fit you, so then you don't have loose gloves in the way. You're not going to put on a pair of sterile gloves that's just going to rip when you put them on. And if you're new to doing this, you want to make sure that you're comfortable doing it. And the right size glove can definitely make a big difference. Nice tight fitting, no extra. So we're just going to set everything up real quick. Sterile flush, needleless connector. Now this PowerLock Max non-coring needle also comes with the extension tubing already attached to it. So we're going to go ahead and open this. And here it is. It comes with a little plastic sheath over the needle. I'm going to take this cap off, attach our flush everything, and I just do it over the floor till it drips, just a drop or two. So now that's primed and ready to go. I'm going to take this little sterile drape and I'm just going to put it right on the patient right here. Just gives me a little bit more extra workspace to use. Now, since I have everything ready to go, I have my primed needle and tubing and valve. Here's my biopatch. Here's my dressing and skin protectant. Now we're going to use our 3 ml ChloroPrep to cleanse the area, 4 to 5 inches radius area, and we're going to want to scrub for 30 seconds. It's good to have a watch or know where it is in the room. So, and then we're going to scrub for 30 seconds. Now it's important when you're using the ChloroPrep to make sure that you allow at least a full minute for it to dry afterwards, because you don't want to put a transparent dressing on wet ChloroPrep skin. It can really damage the skin and cause a lot of irritation and sometimes even pull skin off. So now that has been 60 seconds. I'll just go discard of that, and now we're just going to wait a full minute for this to dry. And a full minute is going to be a long time on a video.
Now it's been.
Now, when you're getting ready to do this, you're going to want to palpate with your non-dominant hand, and you're going to want to insert with your dominant hand. Now, I kind of hold it like this, but this is why I put this little field on there. So if you want to go ahead and put your sterile flush down in that field while you put that in, that's just fine. But I'm very fine in doing it this way. So we're almost at a minute. We got another 20 seconds here. And also when we do this versus the old way of doing it, we're not going to use 2x2 dressings to put underneath these wings. That is an old practice, and it's no longer considered best practice. So we're just going to put the needle in, biopatch, and then the transparent dressing. So we're now at 1 minute, and I'm going to go ahead and palpate. And I feel my 3 little markers here, and I'm going to insert directly. Let the patient know. I'm going to go ahead and insert the needle now. And you're going to want to push straight down and hard until you feel it stop on that hard back of the port. And now we're going to check for blood return, and I got a blood return. Now I'm going to flush. We're going to flush using our push-pause method, and then clamp at the end. We'll put this down in the sterile field. Now, this IV needle, this new one, is really nice because it actually swivels around. So you can position this tubing wherever the patient would like it. So for the sake of this, we're going to position it with the tubing facing up. Here's my biopatch, which goes underneath. Make sure that biopatch is closed all the way around in order for it to work correctly. Now before I put on my transparent dressing, I'm going to use some skin prep and make sure that skin is nice and tacky before I do this. You can kind of give it a second till it's tacky on your fingers and tacky on the patient. And you can see on this dressing there's a little notch. That's where I'm going to want my tubing to go. So when we peel the back off, I'm going to hold on to the wings here and not actually touch the dressing itself. We're going to put it right over that, and actually it's got a little reservoir in there. Grab that tubing, line it up, tack it all down real nice, and then we're going to take off the excess right here. And there's also another little piece on here like this with another indentation on it. And we're going to take that off, and it goes underneath the tubing, but over the dressing we just put on. And then we'll take off the extra pieces here. And then of course, for any dressing you do, you always want to put the time, the date, and your initials on it. So we'll initial that, and I'll initial date, time, and my initials, and then we can disconnect this. You can put a green cap on it, and there we now have an access port. We're done.